Dr. Neil Riordan is the founder and chairman of Medicinal Panama, Inc., a leading stem cell laboratory and research facility located in the Technology Park in the prestigious City of Knowledge in Panama City, Panama. Dr. Riordan's research team collaborates with a number of universities and institutions, including the National Institutes of Health, Indiana University, University of California, San Diego, University of Utah, University of Western Ontario, and the University of Nebraska. Please welcome Dr. Neil Riordan.
Thank you, Dr. Sears, and congratulations on your new facility. I really appreciate the invitation to be here. I apologize for not getting my talk to you in time for the regular publication. But anyway, thank you so much for having me on this beautiful day in this beautiful room. I had no idea this existed. It's awesome. And I also wanted to say hi to my old friends, Dr. Leonard Smith and Dr. Roger Nocera are here, and also Ray Crawley. So I appreciate the invitation, especially to get to see old friends. So I guess there were some other stem cell talks earlier this morning, and so I'm not going to harp on this, but I am going to introduce a new word to some of you, which is the word is mesenchymal, and it's hopefully the only new word I'm going to introduce to you. It's also pronounced mesenchymal. I use the term MSC for mesenchymal stromal cell or mesenchymal stem cell. So MSC, mesenchymal, and mesenchymal, it's all one word. I'm talking about mesenchymal stromal cells. And so we have, embryonic stem cells, which are pluripotent, tumorigenic, and antigenic. And what I'm talking about today are mesenchymal cells, which have multipotency. They can become other types of cells. They're not antigenic. They're very well tolerated by the immune system, and they're also non-tumorigenic. So I'm only going to be talking about mesenchymal stem cells. And the three things that they do, when I get into talking about the studies we're doing, they may sound very disparate, meaning, geez, you're going to treat spinal cord injury and autism with the same cell. The reason that we do treat we're doing studies with the same cells because they have these three characteristics. They control inflammation, they modulate the immune system, and they stimulate regeneration. And I would propose that most chronic diseases are due to a lack of or a dysfunction of mesenchymal and other stem cells in our body. Our bodies become exhausted as we age. Our mesenchymal stem cells become exhausted. Our other stem cells become exhausted, and they become dysfunctional. And the main thing that we need to understand is that as we age, the number and function of our stem cells declines. So I just described the functions of mesenchymal stem cells. All those functions of mesenchymal stem cells are secondary to their secretions. The cells themselves don't become other tissue. We used to think in the early days of stem cells it's going to be cell replacement. It's not cell replacement. The cells respond to their environment, and they secrete things that decrease inflammation, modulate the immune system, and stimulate regeneration. So this is from Arnie Kaplan. Dr. Kaplan is the godfather of this industry, meaning mesenchymal stem cells. He's the one that gave them that name. Now he's backing away from that name, and he's actually calling them medicinal signaling cells because this is what they do. In response to different stimuli, they can modulate the immune system, and then they have all these trophic effects as well that lead to regeneration, and then they have these immune modulating effects. So where do these cells reside in our body? This is from the body exhibit, and this is where they basically rubberized some prisoner in China's vascular system, and then they digested everything away. So this is the vascular system. These cells reside on our blood vessels. So mesenchymal stem cells are in every organ in your body, and the more vascular the organ is, the more cells there are because that's where they reside. And this picture, I believe Dr. Parita uses this slide, so I don't know if he showed you, but this is a capillary, and the pink cells are actually mesenchymal stem cells surrounding the capillary. So everywhere you have a capillary in your body, you have mesenchymal stem cells. So one of the biggest problems is that our MSC numbers decline by age, right? There's an age-related decline not only in the number of cells, but also their fitness. So this is in bone marrow, and if you look, when you're a newborn, your bone marrow is full of mesenchymal stem cells. Well, by the time you reach skeletal maturity, you become a teenager, 90% of those cells are gone from your bone marrow. Most of them are distributed throughout your body, and that's pretty much what we have to live on for the rest of your lives. And I think Dr. Dean was talking earlier about athletes running out of, basically at 35, you're kind of off the field. And you can tell what's happening to your mesenchymal stem cell count at about that time. This is one of the most interesting slides, not because what was on it originally, but what I put over the top of it. So if you take a single mesenchymal stem cell from an infant, it doubles about once a day. So in every 24 hours, that cell will divide. So if you put it in culture, at the end of a month, you have 1 billion cells. If you take a 35-year-old stem cells, they divide every 48 hours. At the end of a month, you have 32,000 cells. If you take somebody who's 65, they divide every 60 hours. So at the end of 30 days, you have 200 cells. So if you're degenerating at greater than a rate of 200 cells, then you might be losing the battle. And so that's mainly my main message when it comes to aging. So in Panama, we started there in 2007 with 1 employee. We have 45, now we have 50 employees. We have the Stem Cell Institute. This is an offshoot of Medistem Incorporated in the USA. It's a company that we sold last year, the USA company. We're still doing clinical research in Panama. We have 6 doctors on staff. We have 7 clinical trials. They're all on clinicaltrials.gov. We have our first approval for an IND in the US, and that's to treat Duchenne's muscular dystrophy. And we're treating a young man he had been treated 7 times in Panama, and then we came and petitioned the FDA, and they're allowing us to treat him now. And we're starting with our second patient, and then we're going to add a 30-patient trial after that. So we are doing what we can in the US right now, and that's the single trial that we're started with. A lot of people ask me, why Panama? Well, in 2004, they passed a law there that basically said, if you're a doctor and you want to treat patients with embryonic stem cells, you're going to go to jail. But if you're a doctor and you want to treat patients with umbilical cord stem cells or adult stem cells from the patient's own body, from their own fat or from their bone marrow, then you can do it. So that was the enabling law from 2004. There are a lot of other great benefits about Panama. It's a growing economy. It's direct flights from the U.S. It's a great place to live, easy access. Then we were also invited into the City of Knowledge, which is the former U.S. Southern Command and Control for the U.S. Army across from the canal. And when we gave them the canal back, they turned that into a technology park. We're in there with the United Nations and Florida State University, a lot of universities and things. So globally, what's going on? Well, I'll start at the bottom and go up. In the U.S., we're way behind. We're way behind because other countries are approving MSCs for treatment. In South Korea, 1 product's already been approved for osteoarthritis of the knee. Canada and New Zealand have approved another product for graft versus host disease in children, which is a deadly condition. Japan is the new leader, and every stem cell company on the planet is in Tokyo now because they just passed a law. It went into effect last November, which basically shortened the regulatory period to once you demonstrate safety for your product, you can go to market with it. So in as few as 1 year, you can get your product on the market, and there are already 3 cell products that have been approved in Japan. So here's the interest. If you just go on Medline or PubMed and you type in mesenchymal, this is a year-by-year number of articles. You can see that it's going up dramatically, logarithmically, in fact. If you go on clinicaltrials.gov, which is the National Institutes of Health, their website that shows what clinical trials are going on, there are 35 clinical trials going on with mesenchymal cells right now. These are donor mesenchymal cells. These are the conditions that we have clinical trials for in Panama right now. Well, we already covered this. Our commercialization partner is Cook Medical, which is a multi-billion-dollar company. Like I said, we started our first trial in the U.S. September a year ago, and our plans are to do more and more of that. So these cells, what cells are we using? We're using mesenchymal cells from umbilical cords that are donated. The baby's fine, mom and baby are fine, and then the afterbirth comes out, and that's the placenta and the umbilical cord. Well, the umbilical cord contains all tissue from the baby, so those are all young cells that we're getting. The placenta contains a mixture, so we use the umbilical cord because it's not a mixture, it's from young cells. So they have, we heard mitochondria earlier, they have young mitochondria, as kind of as young as you can get from a donor source. These are highly selected. We have a molecular profile that we do on our tests, and this is the advantage that we have having treated 3,500 people, is being able to retrospectively analyze which cells work for what and which cells don't work. And we've created a molecular profile that allows us to, we call to identify our golden cells, the cells that we use for therapy. So the mother's tested for infectious disease, the cord's tested for infectious disease sterility, all the cells are tested for infectious disease sterility and endotoxin. I'll just briefly go through some pictures of our lab space down there and people doing work, and we do flow cytometry analysis of all the cells. This kind of goes through the process. That's a cord on the upper left-hand side. It's dissected. We digest it with enzymes, and then the cells, we grow the cells, and then we freeze them down, and they undergo quality control. So this is a picture. One of my dubious distinctions is that my team discovered the menstrual mesenchymal cell in 2005. And this is the first four-color picture of a menstrual mesenchymal cell. And this is a dividing menstrual mesenchymal cell. And these are menstrual mesenchymal cells that are growing on tissue culture plate. So this is about anti-aging. So I'm gonna give you an example of a single case of a person who would be considered advanced age at 93. His son is a famous movie actor, and he called me up one day and he said, "My dad's got a bad hip. Can you do something for it?" I said, "Well, what's wrong with his hip?" "Well, he had a hip replacement on the other side, and he's got degenerative disease on the other side, and they won't do the hip transplant." I said, "Why not?" He said, "Well, he's in really good shape, except for he just came out of the hospital for kidney failure." So, "Well, does he have anything else wrong with him?" "Yes, well, he's in heart failure too, but he's a tough old bird." So, other than being heart failure, kidney failure, he had a bad hip, and the reason they wouldn't replace it is because he was too sick to undergo the surgery. So, after much consternation and talking to his physician, getting medical clearance, I was worried for him to fly from Los Angeles to Panama, to be honest with you. We got medical clearance. They brought him down on private plane. We treated him into the hip. Let me see, hang on a second. I got to go back. We treated him into the hip with umbilical cord and mesenchymal cells. We also gave him IVs because the IVs, and I'll show you later, are able to home to and release factors that stimulate regeneration. In fact, they don't even have to home to a tissue to release factors in the body which stimulate regeneration in the body. So in his case, we gave him a series of IVs. We gave him one shot in his hip, and he's literally just had his 97th birthday. So it was 4 years ago. 3 months afterwards, he went back to the Mayo Clinic. He was out of heart failure, out of kidney failure. 2 weeks afterwards, he was able to stand. 2 months afterwards, he's able to walk. When he came, he was in a wheelchair, and this was his affect. He didn't move or didn't say a word the entire time he was in Panama. We visited him in LA, and he's running around, jumping around, joking, and literally moonwalking. That's how dramatic this is. So Dr. Dean talked a lot about mitochondria and how they get fat and they get old. Well, the really cool thing about these cells is they can diagnose a cell that has bad mitochondria in it. And what do they do in response to that? They donate mitochondria. So these cells sense the mitochondria, and there's a wonderful paper, and if anybody wants it, I'll give you the reference for it. It was written by Islam et al. And where they showed in an inflammatory condition in the lungs, they basically put something really inflammatory into the lungs of mice. Sorry. And then they followed that by infusing umbilical cord mesenchymal cells. And what they found was that the MSCs would go to the injured lung cells and they would do triage. And if there was no mitochondrial activity, they would leave the cell alone. That cell's dead. Nothing's going to happen. If the cell had plenty of mitochondria, it would leave the cell alone. If the cell was in between and needed help, it would form a bridge and literally deposit mitochondria into the sick cell. So they're able to regenerate sick cells by donating mitochondria. They also secrete a lot of factors. They bud off microvesicles, which can contain mitochondria, but they can also contain growth factors and even messenger RNA for receptors for growth factors. So a lot of Dr. Dean was talking about this can be addressed using these cells and their products. So I'm going to talk about autism, and I'm going to talk about spinal cord injury, and I'm going to talk about rheumatoid arthritis. And the reason I'm talking about them because autism is predominantly an inflammatory disease. Rheumatoid arthritis is predominantly an autoimmune disease, and spinal cord injury is predominantly a problem of not having enough regenerative capacity at the spinal cord. So these are the three things that these cells do. They reduce inflammation, they modulate the immune system, and they stimulate regeneration. So what's the rationale for doing a clinical trial of autism using umbilical cord mesenchymal cells? The main thing is that kids with autism, most people with autism, have elevated levels of inflammatory cytokines. They have immune nodules at the end of their small intestine that secrete inflammatory cytokines. And you can actually measure these in the blood. And there's a recent article that demonstrates that 2 of these inflammatory markers actually correlate very closely with the severity of the autism. And they're called MDC and TARC. And if you've never heard of them, don't feel badly. I'd never heard of them until 2 years ago when this paper was published. But they're 2 inflammatory markers that can be seen in people with autism, and the ones, the more severe the autism, the higher the levels of these are. So this is a study that's now evolved into 33 subjects, but at the time of making this slide, it was 13 subjects. Now we have 20. We have 20 more involved, so we have enrolled. We have complete data back on 11, and basically we're giving them 4 IV infusions of umbilical cord MSCs, one time. They're doing it 4 days in a row. They come back 3 months later, do it 4 days in a row, come back 3 months later, so they cycle 4 times. And that's it. That's the only thing. Primary endpoint safety. We're measuring childhood autism rating scale, ATEC, which is an autism treatment scale that's done by the parents, quantitative EEG, and these inflammatory markers in the blood. And we have 31 different inflammatory markers we're looking at, but I'm just going to talk about MDC and TARC because those are the ones that seem to have the best correlation with outcome. So far we've had no serious side effects. Pain at the site of infusion is pretty much it. And what's amazing to me is typically there's a lot of helter-skelter when you have a new autism patient, and these are all severe. They have to be diagnosed with severe autism. There's a lot of helter-skelter when you try to get a line in a kid. The vast majority of them, when they come back the second time, hold out their arm. So this childhood autism rating scale, it ranges from 15 to 60, 30 being the cutoff for autism. For mild autism, 30 to 37 is mild to moderate, and above 38 is severe. So all of these subjects were severe. And these are the numbers, baseline, after treatment, and the reduction. And if you'll notice, they're all red numbers. So all of them improved on this scale. And I don't know that it shows it there. I don't know that I even have a slide, but basically what happened out of those 11, 3 of them dropped below the autistic level on the cards. So 3 of them went from severe to not being diagnosable as autism. 3 of them went from severe to mild to moderate, and the other 4, you saw they all improved, but they didn't drop down a level. So this is just you doing hard statistics on this, and the p-value on the childhood autism rating scale for all subjects was p less than 0.001, which is highly statistically significant. Here are all the raw CARS scores before and after, just graphically. Anyway, this is this study, which I probably should have described before, but this is the study basically showing that MDC and TARC are elevated in kids with autism, and the more severe the autism, the higher they're elevated. So they actually can be seen as biomarkers of autism. So this is the MDC. This is after the first treatment. The p-value is 0.01, and after the second treatment, the p-value is less than 0.01 as well. And then this is the TARC. This is the pre-treatment on the left, and then post-first treatment, post-second treatment, both highly statistically significant. There was another study done in China. We're not the only people doing this. They used actually a combination of umbilical cord MSCs and cord blood mononuclear cells. And basically their finding was that they had a significant improvement in CARS with no serious adverse events. So that's autism. Now I'm going to switch gears a little bit and talk about an autoimmune disease, rheumatoid arthritis. And this is a study not done by us. We are doing a clinical trial of rheumatoid arthritis. But this was published, and it's really important because there were 172 patients in this trial. It was a very large trial, and there were 0 side effects, and everybody got better. And they gave them a single dose of 40 million umbilical cord. They gave them a single dose of umbilical cord MSCs, 40 million cells, which is non-toxic to anybody we've ever given it to. And we've given 20,000 doses. So how many people have heard of Humira? Enbrel. Okay, well, they're on TV a lot, and the reason is they're about a $14 billion a year industry in the United States. And what they do is they sop up TNF-alpha, which is one of the sort of the big players in inflammation in the body. And they make you feel like $1 million if you got a bunch of TNF-alpha running around. Well, a single dose in these patients decreased the TNF-alpha by 50%, and that persisted for 8 months, one shot. They did another cohort where they gave them another shot, and what was left decreased by another 50%. So they had a total of 75% reduction in their TNF-alpha. And why is that? Well, basically, this is just showing those are quality of life scores at the top that they got improved. And these people were on their standard drugs for rheumatoid arthritis. And with the umbilical cord MSCs, you can see that these are quality of life scores, and then the other one's a joint score, and they both improved. Then the CRP, which is inflammatory C-reactive protein, and rheumatoid factor also went down in the treatment group, whereas they didn't in the people just getting the regular stuff. So here's, again, this is up close and personal. Here's the quality of life score, and here's the joint score. Both decreased after the first and further improved after the second treatment. And then this is the reason why. The bottom of the slide, you'll see an upregulation after the treatment. These are called T regulatory cells, and they're modulators of the immune system. They say to the inflammatory part of the immune system, hey, calm down. They're kind of like the mother cell of the immune system, and calming an active situation down. And where they work, well, here's IL-6 and TNF-alpha. I don't want to overwhelm you, but you can just look and see that both the IL-6, which is now a target for new biologic drugs that are out, and TNF-alpha decreased dramatically. And the reason is, do I have a pointer on this? Or I guess I can't point. But anyway, if you look at the very top, this is an activated T cell. In all autoimmune diseases, you get activated T cells. Well, in this kind of autoimmune disease, you get activated T cells, and you basically get an army of these activated T cells. And in the case of rheumatoid arthritis, they're migrating into the joints and doing tissue damage. So the T regulatory cells works at the very top of that and prevents the division. It doesn't prevent the activation of T cells, so it doesn't have this severe immunosuppressive effect on the body, but it blocks those clones from being too active and creating more of themselves. So now I'm going to jump right from there to spinal cord injury. Because in my mind, the reason the spinal cord doesn't regenerate itself because there are very few mesenchymal stem cells in your spinal cord, in and around your spinal cord. Whereas the rest of our body, for example, your liver is swamped full of MSCs, and you can actually cut 80% of your liver out and it'll grow back. Well, we don't have that luxury. Nature or God created this wonderful cage around our central nervous system to protect it, invested a lot evolutionarily into this wonderful column around our spinal cord and this thing around our brain to protect us, our skull. And so we didn't invest a lot evolutionarily into repairing it, because basically if you break it, you're dead anyway. I mean, if you think about it, back in the day, anybody that suffered a spinal cord injury was typically a goner. You couldn't hunt, you couldn't fish, you couldn't gather. So anyway, I believe that there's a deficiency. There is a relative deficiency of MSCs in the spinal cord. It has a limited capacity of repairing itself. So this was a study done in rats, and they took and they cut the spinal cord of the rat, and that's a cartoon showing the spinal cord retracting, and there's a little bit of gap there, so it's a full transection of the cord, and they put in umbilical cord MSCs from humans. And lo and behold, these spinal cords regrew. And the most interesting finding here, the biggest point I want you to take home from this, not only did the spinal cord regrow, but because they were human cells, you could fish for them. You could say, are there human cells in there or not? And there were human cells stuck between the new fibers. But the human cells did not become spinal cord. The human cells secreted things that stimulated that spinal cord, those spinal cords, to regrow themselves. And here, this is the control. You can see that's the number of neural fibers. So there's very little in the control. There is some spontaneous neural fiber reconnection, even if you completely transect the cord. If you added the stem cells, there was a massive increase in the number of regenerated fibers. But if you took just the conditioned medium, the stew, essentially the milk that the cells produced when they were in culture, and you put that in there, you still got regrowth. So you didn't even need cells present to get some of the regrowth. So that's my major point. It's not the cells, it's what they're secreting. And because you had the cells in there secreting for that period of time, you got a better result than just a single infusion of the actual juice. So this is a 1-year look at the last 70 patients that were treated in Panama, and these are improvements. The percentage of patients that improved in any of these categories is 70%. You can see self-care is low, respiration sphincter about 50%, mobility about 50%, extremity trunk and function is a little bit higher, sensation is higher than that, and pain reduction is the number one thing that we hear, that there's a tremendous pain reduction. So this is a young man. This young man was minding his own business in a bar. Some crazy guy came in and started shooting. And he was paralyzed for 14 months before he came down to Panama for treatment. And his mom sends me these videos. And if you could just press the first one. These are milestones for him. So this is the first time he moved. And you can see he's walking with, obviously he's well taken up. And if you could click on the next one, he's braced up. And the next one, this is all his own movement right here. He's able to squeeze. And then the next slide will show him on the bicycle. And that's all his own power. And then the next slide, please. So, yeah. And he hates doing those videos, by the way, but he did allow me to. He literally, in one of them, I told him to turn the sound down because he's swearing at his mother. Shut off the video. But this young man, Juan Carlos Murillo, was was a commercial pilot. He was flying his own personal plane, and he crashed and broke his back. It broke at 3 levels. He was in Asia A, which means he had no function or sensation below the injury. 6 months after the injury, we started treating him with umbilical cord cells, both through, when I say both routes, we gave him both intrathecally into the space around the spinal cord and intravenously. And he could literally walk in here today and you wouldn't know he had a spinal cord injury. He's completely recovered, JC. And he actually received his commercial pilot's license back. But he when he couldn't fly, he started his own business, and he's so successful he doesn't fly commercially anymore. He just wanted to get. But anyway, we wrote this case up, and that was in 2010. We wrote that up. So one of the main things people want to know about is safety, because boy, it freaks me out if you're going to take somebody else's cells and give them to me, right? So what's your rationale for that? Well, every mother in here who's ever had a baby, if we look at your bone marrow and your bone marrow and your bone, we'll find stem cells from every baby you've ever carried, up to 50 years later, right? So we know that your babies are 50% genetically distinct from you. So I get a little bit of solace in knowing that 50% genetically distinct cells aren't automatically rejected or don't cause a great deal of harm, right? And it was once thought that women had a higher incidence of autoimmune disease or mothers had a higher incidence than non-mothers. That's since been disproven. It's actually the opposite. Mothers have decreased incidence of autoimmune diseases. And here's the really cool thing is that you would think with the stress of giving birth and then raising them and all the stresses of parenthood would reduce your lifespan. Actually, it's the opposite. Women live roughly a third of a year longer per kid that they have. And that plateaus at 14 when the suicide rate goes to 100. No, just kidding. So one of the things everybody wants to know is, wow, these MSCs have been implicated in cancer. I mean, you find them in tumors and all sorts of stuff. What's my cancer risk if I'm taking umbilical cord MSCs? Well, this was a study we had to do for the FDA to show this was for our menstrual cells, and we actually took animals that had a brain tumor, a glioma, and then we gave them injections of the menstrual cells, both intravenously, which is in the middle graph, and this is the amount of tumor they had after the treatment, or directly into the tumor. And you can see by either route of administration, the menstrual cells decrease the size of existing tumors rather than added to it, because that's what we need to demonstrate to FDA. So this study, if you just read the title, it tells it all. But rat umbilical cord stem cells completely abolish rat breast carcinomas with no evidence of metastasis or recurrence 100 days after the tumor cell inoculation. So here's a control animal on the left. So they implant a bunch of cells. The tumor starts growing, and then it metastasizes through the rest of the body. And then on the right-hand side is an animal that was treated with umbilical cord mesenchymal cells intravenously. They gave 3 shots IV, and that's what happened. The tumor dissolved. And here's they did it both into the tumor and IV. They did 1 shot into the tumor, or 3 shots IV, and got the same result. This is the tumor volume over time. Those are the number of days afterwards. And you can see in the PBS, which is the control, they had to sacrifice the animals because the tumor volume was so great. If you look at the other ones, all the tumors shrunk and disappeared by day 42. So, in summary, I have 3 minutes left. I think that MSCs are either dysfunctional or lower in number as we age, and all these age-related diseases that we see are secondary to that. There's also less space for these things to live, right? So capillary density is everything, because capillary density is where our MSCs live. So if we do things that reduce our capillary density, like smoking and being inactive and all the things that we know are bad for us, we're decreasing our capillary density and therefore decreasing the homes we have for our MSCs. So when the home goes away, so does the MSC. So these MSCs secrete and encourage regeneration, they calm inflammation, they calm down the immune system. And boosting your own MSCs with younger cells may impact certain chronic diseases. And in Panama, we're leading the way on that research. So I think that's about it. Thank you very much. Appreciate it.
Thank you, Dr. Riordan.